I'd like to discuss some of the options in treating bunion deformities and why I've chosen the keyhole bunion correction as my preferred technique. Bunion corrections can be performed via an open technique or a keyhole technique. The open technique is where an incision is made along the inside or the medial side of the great toe, and the two main bones of the great toe are repositioned to straighten the toe. This is typically done under direct vision once the soft tissues have been incised and the capsule of the first MTP joint has been opened. In comparison, the keyhole technique is performed through tiny 3 to 4 mm incisions, with the majority of the procedure performed under X-ray guidance. Rather than needing to directly visualise the bone through that incision, I'm performing the procedure by looking at the X-ray machine and obtaining appropriate images of the bony osteotomies that are required. The open bunion correction technique has been around for decades. I've been exclusively performing keyhole bunion corrections since 2017, performing hundreds every year. There are many proposed advantages to the keyhole bunion correction, and I'd like to discuss some of these with you now. Traditionally, bunion surgery developed a reputation for being quite a painful procedure to recover from. I've found personally with the keyhole bunion correction that the vast majority of patients are very pleasantly surprised with their level of comfort following the procedure. Performing the bunion correction utilising keyhole techniques ensures that there's less soft tissue dissection required at the time of the procedure. In my opinion, this greatly improves the comfort levels of my patients following the procedure. Our anaesthetists are also excellent in performing local anaesthetic nerve blocks around the foot and ankle prior to the procedure. This provides pain relief during the first 18 to 24 hours. One of the other main benefits that I see with the keyhole technique is improved range of motion of the first MTP joint. Performing an open bunion correction requires significant soft tissue dissection around the first MTP joint and involves what's called an arthrotomy. This involves cutting the capsule and soft tissues around the first MTP joint itself. It's my view that this increases the risk of developing stiffness within the first MTP joint. In comparison, the keyhole technique does not involve dissection of the soft tissues to that degree. This ensures that patients have a greater chance of improving their range of motion of their first MTP joint following the procedure, which is critical to foot function.